The next topic of communicable disease which we will see is smallpox. So we are not dealing it in lot of explanations will not be given for all these topics. Just a brief introduction and then the content will be dealt. Now smallpox is also one of the communicable diseases which is actually controlled already. It is actually acute infectious disease and it is caused by variola virus. And the smallpox was actually clinically characterized by certain symptoms like fever. There was also headache, backache, then vomiting, nausea. Then it also had sometimes seizures or convulsions. And along with that, there was also appearance of a rash. It usually was having series of different stages. This rash was in different stages, that is macule, then it had become papule, then a vesicle, where it was fluid filled, then pustule, that was pus filled type of vesicle, and then after while it was in healing stage, it resulted in scab formation, and later it resulted in scarring also. And the smallpox was considered to be a major killer, and it was told to be endemic, and it has spread to many countries. Nearly 33 countries were affected by the smallpox, and in India, it was declared as smallpox free in the year 1975, and worldwide it was declared free of smallpox in the year 1977. So, thus, we are not having the smallpox presently. Next one is moving on to chickenpox. So, chickenpox also we are knowing it is a highly contagious condition and it is caused by varicella zoster virus. Okay, chickenpox is caused by varicella zoster virus. It is highly infectious, and when you are getting affected with chickenpox, usually there is fever, body pain, weakness is there. Along with that, it results in something like a development of a rash all over the body. Now, don't think that chickenpox is related to something with chicken. There is nothing related to chicken here. Now, moving on to the introduction or the definition part itself, chickenpox is caused by the virus varicella zoster and it results in formation of a rash, particularly like a blister that is present all over in the body. Initially, it will be present in the trunk region and all. Later, it can spread even to the face and the other parts of the body. And it is told that chickenpox is a primary lesion, while this herpes zoster is told to be a reactivated lesion. That is, sometimes what happens is these varicella zoster virus, it can go into a dormant stage, which can be later reactivated. When it is reactivated in the later stage, it can result in herpes zoster. Next is risk factors. Risk factors are commonly this chickenpox is seen in children less than 10 years of age, but chickenpox is also seen in adulthood. But if it is seen in the adulthood period, it is told to be very severe. It is commonly seen in people with low immunity. Then it is also seasonal. Commonly, it is seen in the winter as well as in the spring. Then it is spreading very rapidly, especially where there is overcrowded places and all, it will spread very rapidly among them. And this chickenpox is transmitted from person to person because of close contact, while touching, face to face contact, or because of droplet infection also it can be transmitted. It is also told that it will be transmitted by oropharyngeal secretions or by lesions on the skin or even in the mucosa. Now, the incubation period of chickenpox is in between 14 to 16 days, and infectivity, that the person will be highly infectious in between 1 to 2 days before the appearance of the rash and 4 to 5 days after the appearance of the rash. But once the complete rashes are healing, after that they will not be infectious usually. So most of the time, nearly 2 days before the appearance of the rash and 4 to 5 days after the appearance of the rash, they are told to be highly infectious. Next is the clinical manifestations or the features of chickenpox. Now, most of the time, some individuals will be having very mild symptoms. That is only the rashes will develop with certain with fever or with the pain or headache and all. But some individuals may have severe clinical manifestations of chickenpox. So it is classified into different stage. First one is pre-eruptive stage. So before in the pre-eruptive stage, that is before the rash appears, usually the individual will be having fever. Along with that, they can be having back pain, severe weakness will be there in the body, then joint pains, malaise will be there, and usually it can last for up to 24 hours. Next is eruptive stage where there is appearance of a rash, okay, in the body, and the rash is told to be symmetrical in nature. So as I have told, this rash will first appear in the trunk region, then it will be spreading to the face, arms and legs. Sometimes the rash can be also seen in the axilla, even in the buccal mucosa, that is inside the mouth. So sometimes it is very difficult for the patient to even have food or to swallow and all. Then slowly, as the rash is advancing, it will appear in different stages like macule, papule, then vesicle. Then as it is healing, scab formations will be there. Then scab forms 4 to 7 days usually after the rash. So you can see in the picture how these rashes are being formed here. Then usually these vesicles, when they are formed in the body, they will be giving a drop appearance, like a watery appearance. So along with that rashes, that time also the individuals will be complaining or having anorexia, then fatigue, headache may be there, fever or sore throat. Then body pain will be usually present. They will be complaining of severe body pain. Some people also have abdominal pain. So that is regarding the chickenpox. So the stages we have already discussed. So 14 to 17 days of incubation period. First they will develop with fever, headache, sore throat, all the prodromal symptoms, then vesicles, pustules, then scab formation, that is usually after 4 to 7 days. Next is complications. Sometimes a person can develop with complications in chickenpox. Especially complications are more seen in adulthood period. So children usually don't have much of complications, but sometimes they can have pneumonia, then encephalitis, that is in inflammation of the brain parenchyma, and because of this inflammation of the brain parenchyma and because of mental deterioration, it can result or it can alter your brain function. So that is referred as encephalopathy. Along with that, it can also alter the gait and balance of a person that can result in cerebellar ataxia. Along with that, some patients can also have very low immunity, and because of that, they can develop secondary infections like nephritis, arthritis, or myocarditis. And some people can also have varicella hemorrhage where they can develop with excessive bleeding also. Most of the time, during the time of pregnancy, if they develop with chickenpox, it is told to be life threatening because a woman who has developed with this varicella infection during pregnancy can have birth defects. Sometimes it can result in low birth weight of the baby, and sometimes also it can result in death of the child. Next is diagnosis. Now, most of the time we can just collect the history, see the signs and symptoms. That is, you can do the physical examination and see the rash. So that is how you will usually perform the um, diagnosis. But other than that, you can send the scrapings from the rashes sometimes. Sometimes you can also perform ELISA test or serology test also can be performed in order to detect whether it is chickenpox or some other cases. Now, next is regarding the treatment. Now, treatment is most of the time not very essential. Usually, some home remedies itself can be done in order to treat this chickenpox, like taking bath in the neem water and all. But otherwise, they can usually give the treatment with the antiviral agents. Antivirals, especially acyclovir, is given. Other than that, since patient can have a lot of itching on the rashes, you can give them with antihistamines. Then to treat or reduce the fever, you can give antipyretics for the patient. Then, if they have a lot of body pain, analgesics can be given. Sometimes you can also prescribe other medications depending upon the signs and symptoms if they are having sore throat, cold, and all. So, other medications also could be given to the patient. But most of the time, we do recommend using some home remedies itself. Now, other than that, for prevention of chickenpox, we can give chickenpox vaccine. First dose is usually given 12 to 15 months. Second dose is given at 4 to 6 years of age. Then people who have not been vaccinated earlier, if at all they want to get the vaccine of chickenpox, especially for adults, the people 13 years of age and older, they can receive two doses. Usually it should be at least 28 days apart. So first dose if you have taken today, so after 28 days you have to take the next dose. So that is how you will take the vaccine for chickenpox. And most of the time, this varicella vaccine contains this live virus. So most of the time, children who are having very low immunity also may not be given with this virus. Next is this is regarding the home remedies. Most of the time, you can apply calamine lotion. You can also give antihistamines. Then it is told that aloe vera gel or garlic, lemon, ginger, neem. These are all are told to be very effective. Next one is moving on to meningitis. Now, meningitis, it is the infection and the inflammation of the meninges of the brain. So, we are knowing that meninges is actually the protective membrane or the covering, which is usually the layer which covers the brain as well as the spinal cord. And meningitis means it is the infection and the inflammation of the meninges. We have got different types of meningitis, that is bacterial meningitis, viral meningitis, fungal meningitis, and non-infectious meningitis. Now, bacterial meningitis is caused by bacteria, viral meningitis is caused by virus, fungal is caused by fungi, non-infectious is caused by certain other conditions that we will see in the etiology. Now we will see the etiology. Now, as we have discussed, meningitis is most of the time caused by the microorganisms itself. It could be bacteria, virus, fungi, parasites, or protozoa. So, most of the time, bacteria like Streptococcus pneumoniae, then Neisseria meningitidis, Haemophilus influenzae, then Staphylococcus, then Listeria, all these organisms can cause meningitis. Then viruses like herpes simplex virus, mumps virus, measles virus, or varicella virus can cause meningitis. Then under fungi, we can usually this aspergillus and candida can cause meningitis. Then other than that, other infections like if you have got a history of sinusitis or otitis media or mastoiditis, that time also it can result in meningitis. Now meningitis topic is usually related to neurological system and is dealt will be dealt in third year. Risk factors are meningitis is seen commonly in people with very low immunity, or if they are having chronic illnesses like diabetes mellitus, or if they have got tuberculosis or HIV AIDS or cancer patients. In them usually this meningitis infection can be seen, or it can be also seen in patients with the who are taking chemotherapy or radiation therapy. And sometimes it is told that meningitis is seen in most overcrowded places, because it could be also because of respiratory route. Because of respiratory route also sometimes it can spread. Then malnourished people also can get meningitis because of low immunity, or if they're taking certain drugs like corticosteroids, or if they have skipped certain vaccines, that is especially your hip vaccine or meningococcal vaccine. Then people who are drug abusers, chronic alcoholics, or chronic cigarette smokers, all these people are at risk of developing meningitis. Even young children can get meningitis. Next one is pathophysiology. So due to etiological factors, what will happen is the microorganisms will enter, they will multiply, and the infection will continue. When the infection continues, it will cross the blood-brain barrier. Because of that, the infection will result in inflammation and there is release of inflammatory mediators. So because of this inflammatory mediators, again what happens is the infection is not resolved here, it goes on continuing and it will cause the infection of the meninges of the brain. So because of this infection of the meninges, it will result in cerebral edema and it will increase the intracranial pressure. Because of that, it will alter the cerebral perfusion. So it will result in decreased cerebral blood flow and it may result in complications of meningitis. Now next, moving on to the clinical manifestations of meningitis. Now the clinical manifestations are, first of all, the patient may be complaining of headache. They can also have nausea and vomiting. They can have fever. Along with fever, they will be having photophobia, that is sensitivity to light, photopsia, that is sensitivity to sound. Sometimes they can, because of the infection of the brain, it can result in confusion, disorientation, irritability. They will be restless and drowsiness. Then changes in the behavior is seen. Then changes in consciousness. They may not be usually alert, so drowsiness, stupor, that also is seen. Sometimes memory changes happen, excess of fatigue is also present, and they can have signs and symptoms of increased ICP, like knuckle rigidity, that is neck rigidity, then decreased level of consciousness, nausea, vomiting, headache, okay, and drowsiness is also to be seen. So next is particularly about the signs that is seen in meningitis. So these are the two important signs of meningitis, Kernig sign and Brzezinski's sign. So first one is Kernig sign. You can see it in the picture also. So Kernig sign is also positive in meningitis and Brzezinski's sign is also positive in meningitis. Now, in Kernig sign, you have to ask the patient to lie in a supine position. Okay. After that, you have to flex the thighs at 90-degree. Okay, when you're flexing the thighs at 90-degree, it can cause severe pain and spasm of the hamstring muscles. So if the patient is experiencing severe pain and spasm of the hamstring muscles, it is referred as Kernig sign. Next one is Brzezinski's sign. So Brzezinski's sign is also positive in meningitis. So here also ask the patient to lie in a supine position. Next, what you have to do is you have to flex the neck. Okay. So whenever the flexion of the neck is done, it will result in flexion of the knee and the hip. Okay, when you are doing the flexion of the neck, it will result in flexion of the hip and the knees. So that is because of the stiffness of the neck actually. Okay, other than Kernig sign and Brzezinski sign, some other symptoms may be seen like seizures, hydrocephalus, then altered mental status, cerebral edema, increased ICP, and sometimes death also can happen because of septicemia. And hearing loss is also seen in certain individuals. Next is how to do the diagnosis of meningitis. First of all, perform history, correct physical examination, perform Kernig sign and Brzezinski sign. CT scan and MRI may help to detect that meninges is infected. You can also do lumbar puncture. Then you can send the CSF for analysis. That is cerebrospinal fluid can be sent for analysis. Next one is EEG, electroencephalogram. That is you are recording the electrical activity of the brain. Then blood investigations like CBC can be done and you can also perform blood culture to detect which organisms are present. Next is the treatment or management of meningitis. Now most of the time you can give antibiotics to the patient. Like if it is a bacterial infection, you can give antibiotics like ampicillin, vancomycin, penicillin. If it is because of a virus, you have to give obviously antivirals like acyclovir. If it is because of fungi agents, then give antifungals like amphotericin B. Patient can have headache, so you have to give analgesics like acetaminophen or paracetamol, ibuprofen and all. Then along with that, to reduce the inflammation, to reduce the cerebral edema, you can give corticosteroids like hydrocortisone and dexamethasone. For fever, you can give antipyretics. To reduce nausea and vomiting, you can always give antiemetics like most of the time you can give metoclopramide. Then since the patient is irritable or restless, you can give sedatives for the patient. Next is general management. Hospitalization is very necessary for the person, then adequate bed rest should be advised. Then you have to monitor if there is dehydration. Start with IV fluids or NG tube insertion can be done. Continuously monitor the vital signs, neurological status, that is GCS scale can be used. Monitor ECG, EEG, ABG analysis, that is arterial blood gas analysis. Then observe the pupil size and reaction. Monitor the intake output and see the level of consciousness of the patient. If the patient requires, you can give oxygen therapy. If they are not able to breathe, then you can intubate the patient and keep the patient on ventilator. Sometimes if the person is highly infectious, you may need to keep the patient on isolation. Most of the time, if the patient is having cerebral edema, you can elevate the head end, then keep the patient in a calm and quiet environment. If they have got hearing loss or deafness, in that case, you can use hearing aids like cochlear implants. Then, for prevention of this meningitis, you can use meningococcal vaccine or Haemophilus influenza type B vaccine, which is referred as HIP vaccine. So this is the normal CSF findings. This also can be asked for 2 marks. Pressure is 8 to 15 mm of He. Appearance normally it is clear and colorless. The normal glucose level in CSF is 50 to 80 mg per dl. The protein level is 15 to 45 mg per dl.